The triangles of the neck are anatomical regions formed by the boundaries of the sternocleidomastoid muscle, the mandible, and other structures. These triangles are typically divided into two major categories, the anterior triangle and the posterior triangle, each further subdivided into smaller triangles. Below are the details of these triangles with their boundaries and contents. 1. Anterior triangle. The anterior triangle is located anterior to the sternocleidomastoid muscle and below the mandible. It is divided into smaller triangles. A. Submental triangle. Boundaries: base, body of the hyoid bone; lateral, anterior belly of the digastric muscle, both sides; apex, chin. Contents: submental lymph nodes, small veins forming the anterior jugular vein. Submandibular digastric triangle. Boundaries: superior, inferior border of the mandible; lateral, posterior belly of the digastric muscle; medial, anterior belly of the digastric muscle. Contents: submandibular gland, facial artery and vein, hypoglossal nerve, Sientuelin, submandibular lymph nodes. C. Carotid triangle. Boundaries: superior, posterior belly of the digastric muscle; lateral, sternocleidomastoid muscle; inferior, superior belly of the omohyoid muscle. Contents: common carotid artery, bifurcation into internal and external carotid arteries; internal jugular vein; vagus nerve, CNX; hypoglossal nerve, CN12; ansa cervicalis, deep cervical lymph nodes. D. Muscular triangle. Boundaries: superior, hyoid bone; lateral, superior belly of the omohyoid and sternocleidomastoid muscles; medial, midline of the neck. Contents: infrahyoid muscles, sternohyoid, sternothyroid, thyrohyoid, omohyoid; thyroid gland; parathyroid glands; trachea, esophagus. 2. Posterior triangle. The posterior triangle is located posterior to the sternocleidomastoid muscle. It is divided into two smaller triangles. A. Occipital triangle. Boundaries: anterior, sternocleidomastoid muscle; posterior, trapezius muscle; inferior, inferior belly of the omohyoid muscle. Contents: spinal accessory nerve, CN-line; cervical plexus; cutaneous branches; occipital artery; lymph nodes. B. Supraclavicular subclavian triangle. Boundaries: superior, inferior belly of the omohyoid muscle; anterior, sternocleidomastoid muscle; inferior, clavicle. Contents: subclavian artery and vein; external jugular vein; brachial plexus trunks; lymph nodes. These triangles serve as important anatomical landmarks for surgery, clinical diagnosis, and understanding the course of vital structures in the neck.